Hey, good afternoon, everyone. Nice to be here with you all today and with this esteemed panel. It's really great to hear about this program starting up and getting going here at Wake Forest University, and I'm just really enjoying the day here with you all. I'm going to share just a few quick examples of some of the environmental justice work we're doing at the State Health Department, and the goal is just to kind of give you a quick overview to kind of start the discussion and, here, I'm sure you all can tell me more about what we should be doing at the State Health Department. So, hopefully we can have bi-directional discussion once we get going here. So my goal is to share some things that we are currently doing to enhance environmental justice and public health. And just kind of following on the discussion this morning, I just want to give one quick explanation, which I know some folks in this room are very well aware of, but I also know that when speaking to a general audience, there will be folks that aren't aware, and that is the difference between DHHS, the State Health Department, and DEQ, the Department of Environmental Quality. We are both at the state, we work side by side, but DEQ operates very separately from us and has a different role, a regulatory role, whereas we are the health agency, and so we make largely health recommendations based on the information we have in various situations. And so, just kind of highlighting those differences in roles, I think when I was going through public health school and, I don't think I understood that difference. And of course, there are many other state agencies as well that are all working towards this, and I'm going to talk more about what some state agencies are doing for environmental justice as well. But I just want to give that explanation up front as a starting point. So one of the things that I think is really important for us to do at the State Health Department is to help implement policies that can change the historical and institutional patterns that we have here in North Carolina. And these are a couple pictures from last fall when Governor Cooper signed Executive Order 292 for environmental justice. That was referenced this morning. That came about because a lot of hard work by advocates across our state for an executive order specifically focused on environmental justice. And so that was signed last October. And Sherry White-Williamson is there on the pictures that I took speaking during that day, and she'll be speaking later this afternoon. So this charges us with quite a few things, and I want to review some of those charges on the next slide. One, the executive order creates the Governor's Environmental Justice Advisory Council, which I'm co-chairing along with Jim Johnson from the UNC School of Business. And that council is 11 members of the public and 11 members from cabinet agencies. And so it's an interesting mix of folks and of perspectives, and I think it's a very valuable mix of perspectives on that council. Each cabinet agency is required to develop at least 3 measurable environmental justice goals and outcomes. Those goals have been drafted. We just, on April 22nd, closed the public comment period. So we are now digesting all of those comments, many of which came from folks in this room, which I very much appreciate. And the next step will be for both the council to provide feedback and help the various agencies incorporate the public comments that they received, and then those goals for each cabinet agency will be finalized. There's also a charge to the council to help lead the creation of a North Carolina environmental justice mapping tool in EJ Hub. And anyone who works in environmental justice knows there's a number of tools out there, including our own at DHHS, the Environmental Health Data Dashboard. But the goal here is in response to the feedback that has been received repeatedly that we need a unified statewide tool. And so that's the goal of our environmental justice mapping tool and hub. And the first version of it should be out this fall. It will not be a perfect version, but the first version should be out this fall. And that's very active work happening right now to determine the data sources and work with our Department of Information Technology to develop it. And then another really important part of the work that we're doing on the Advisory Council is the development of a framework and methodology for assessing cumulative impacts. And again, that came up this morning, and it's basically the idea of how do we, in some way, measure, quantify, implement the practice of assessing cumulative impacts so that it can inform permitting and other decisions in the state of North Carolina. And so there has already been some work toward that end. We're going to build on that work and keep working towards providing that framework. Just pointing out public comment just closed. Okay, I'll just real quick give I just want to highlight really the top definition here. But we've kind of talked about this already, but basically the idea of cumulative impacts is the total harm to human health that comes from the combination of the environmental burdens and, not just pollution and poor environmental conditions, but also those pre-existing health conditions and other social factors. So it's basically acknowledging that all of those things are coming together to create impacts on communities. And so a couple of other initiatives that are happening at the State Health Department. One is that we are encouraging inclusion of environmental justice in community health assessments. Community health assessments are completed by local health departments across the state. They're required to complete them on a roughly 3-year cycle and submit them to the state. And so we've really been working to lift up the example of Alamance County, which was the first county to have a chapter on environmental justice in their community health assessments. Although other counties have mentioned environmental justice, but they had a specific chapter developed. And we have current outreach being led by Joe Bowman on our team to encourage other local health departments to also include environmental justice. Please talk to me afterwards about this if you are in a county where there might be some interest or if you want to hear more about that work. Joe is also working with a number of community organizations to help connect the local health departments with community concerns in those local communities. And so that's very active work right now. And to support that, we also just awarded a small grant to the Western North Carolina Health Network to help 16 counties in the western part of the state do this, including climate justice and environmental justice in their community health assessments. We also, and I think this funding opportunity came up this morning, first thing, but I think it was as I was walking in, we were just recently awarded the EPA Environmental Justice Government to Government grant. We were selected last fall, but still waiting to actually receive the funds. But I know they're coming, and that is a very important partnership for some work in Sampson County with the Environmental Justice Community Action Network and other partners. And our goal there is to, one, continue to support testing for private wells in Sampson County, and then two, to provide treatment to folks. Anyone who works on private wells and the challenges across the state, where about a quarter of the state is on private wells in North Carolina. Anyone who works on that knows that there's some barriers to treatment, but people can, often get their wells tested, but then there are very few resources for treatment. And so this is just one step in that direction, but our hope is that by working with this community partnership and providing this in Sampson County, we can then build on that and expand to other counties and look for additional funds to do that. And so very important to have the community partners like the EJ Community Action Network, Open Heaven Community Center, as well as UNC, Chapel Hill, and App State to help us with the testing. And this is just a quick photo of some of the partners on that project. Another piece is environmental justice and fish consumption advisories. So DHHS is the agency that analyzes data and puts out fish consumption advisories when we have the data to support them in various sites around the state. You may be aware that last summer we actually put out fish consumption advisories for the first time for PFAS in the Cape Fear River. And this is the middle and lower Cape Fear River and not going all the way to Wilmington yet. But when we developed those advisories, we had a lot of conversations, did a lot of outreach to try to understand what the community concerns were. We know that folks are fishing in the Cape Fear River for subsistence, and whether we have advisories or not, they will likely keep fishing in the river, and we understand that. But also feel like it's our responsibility when we have the information to put it out there so that people can make choices if they have them on where they are fishing. This is a huge issue, and part of the problem is that we don't have comprehensive data across the state. We have data on some sites and not others, so we have a hard time being able to point people to better sources, and with PFAS, and we won't go too far down that road, it's not clear whether there are better sources or not. But this is something that we're working really hard on, and there's actually, as of a meeting that occurred last fall at NC State, there's a new advisory group that's very actively talking about fish advisories and how to improve them and improve that process and the process of communicating them. And then we're continuing to document the impacts of environmental racism, including cumulative impacts as talked about before. And I'm just, this is a real quick picture of our environmental health data dashboard. And the first tab on our environmental health data dashboard is the CDC Environmental Justice Index. So that's what's shown in that map there. And you can see the eastern part of the state, a little darker colors than other parts of the states, but this is at census tract level. And then another important part of our work is continuing to listen to and lift up the community perspectives about environmental justice impacts. One of the reasons I'm here today is to continue to hear those perspectives and understand them, and here's some of our partners that are listed here. And then last, just a picture from the North Carolina Environmental Justice Summit, another opportunity to learn about those environmental justice impacts, and that's a picture there with Naima Muhammad, who's a longtime mentor of mine. And then last, I'll just, say my final point is, and it kind of reflects the agenda that we have before us today, but really achieving environmental justice takes all of us. We need communities organizing, we need the academic colleagues that are documenting the impacts and doing the research. We need the journalists that are reporting on these topics and helping the broader public be aware. We need state and local officials to understand the health and EJ impacts of decisions. And I'm working very hard at the state level, but we're also really identifying that a lot of these decisions are made at the local level, and how to help folks in counties, making zoning decisions and siting decisions, really understand these impacts. And then also, as mentioned with community health assessments, helping public health departments take action to protect the health of EJ communities. And with that, I'll pause and look forward to the discussion with you all.
It's always a tough situation to follow such esteemed partners on the panel, but I'm happy to be here and honored to be with everyone here. So I'll just jump into it, because I want to give enough time for questions and stuff from the audience. But we are Clean Air NC. We advocate for the health of North Carolinians by pursuing equitable and collaborative solutions that address climate change and air pollution, and we do that across our 5 platform areas. Our environmental justice program manager, Z, is here. Our community science program manager, Deja Wall. Health program manager, Emily Wolf, who's just joined us recently. We do it through our education program as well as through our advocacy program. So we are a unique entity in the space in terms of what we do as an organization. Although we're based in Charlotte with offices in Raleigh-Durham, we are a state-based organization, and I have the miles on my car to prove it. So I wanted to kind of take a step back, because I'm not an academic. I came from corporate America, and as part of the Great Resignation in 2021, I decided to change things up and come to the good side and be more a part of the solutions rather than the problem. But when I was going through and thinking about this panel, I said, well, how do we think about it at home at Clean Air NC? And I leaned on an IPCC report in terms of looking at the links between climate change and health, and I said, I wonder what, of those things, the top 5 that they identified, how do they apply to us as an organization? And so I highlighted the top ones in terms of water, food scarcity, availability, and quality, increasingly poor air quality, which we directly interface with in terms of the impact on warmer temperatures leading to ground level ozone, and then the worsening particulate matter, which we measure through our PM monitoring systems. And then the climate change affecting mental health was something that we as an organization had started to lean into, because we all realized that not only is it difficult to live in times that we're living in, we also realized that the impact of communities based on conversations that we had had and experiences that we had shared and lived histories that we had heard, that mental health was one of the things that was raised to the forefront because of interactions with community. There's definitely a mental trauma that goes on and is associated with mental health. as we look at our home market, which I'll talk about in a second, in the historic West End, or across the state, whether it be the western part, the middle of the state, or more importantly, where we're doing a lot of work now in southeastern North Carolina. So this was kind of one of the setups for what I thought I would bring to the table today. So when we look at some of the key issues that we talk about, climate-driven mental health, obviously when you think about the impact on everybody's mental psyche, whether it be the work that we do, the environments we live in, or the challenges that we face every day, any one of us can look down that list and say we felt the effects of these issues relative to climate. When you think about some of the other key issues, I'll come back to the second one, but what we've been listening to and hearing during the New Carbon Plan, which we did an education series and webinar and put out a toolkit. Our role in that situation is really to teach folks how to advocate for change through the process, which is what our organization was founded on. But you look at some of the bigger macro issues as they will impact the state, and I had to put in the U.S. Supreme Court ruling in Sackett v. EPA because of how they classify water and what that means for our state, not just from a connected body of water standpoint, but what's happening on the coastal fringes. And we celebrated Earth Day as an organization this past Saturday, and we had 2 film screenings. One of them was Freedom Hill, and the other one I'm drawing a blank on, which was
Say Goodbye to Forever Chemicals.
Say Goodbye to Forever Chemicals, PFAS. And I'm always attuned to, when you hear something new, I think you have a responsibility in this space to kind of lift it up. Just like I heard this morning that when you dry out pine, it creates particulate matter. Taking that to the bank to do some research on that. But we heard a term called racialized topography, and that was something in terms of racial geography I was familiar with, and obviously the EJ screening and GIS tools that we use as an organization play into that. But I don't think we had ever heard the term racialized topography and the description of what it is. So I thought I'd bring that here to share and lift that up in terms of what's going on in Princeville, North Carolina, and Brunswick County.
There were some political geographers who did a study of over 100 southern cities in the United States. Across all these 100 cities, higher ground, predominantly white, lower ground, predominantly black and brown, right? And so they call that phenomenon racialized topography. So they could predict the racial makeup of certain landscapes just based on race. A lot of these cities and towns, particularly Tarboro, which is right across the river, right across the Tar River, dates back to, the days of George Washington and really the foundings of, the U.S. colonies. The white folks, essentially, in the Southeast, claimed all the high ground for their towns and their cities. So you could buy land, but you kind of bought it knowing that it was land that was refused or undesirable by white folks. Freedom Hill and Princeville, Freedom Hill, ironically, Hill, they built up the land in a floodplain, in a valley that's designed to flood. And it's not unique to Princeville.
So one of the things that I'd like to talk to the team about is once you hear something, you can't forget it and you have to share it. So I hope that everybody realizes that this is another part of our history as a country around environmental justice. So I wanted to also share some of the things that we're working on in the EJ space so that we also give lens to what we're doing as an organization to be a part of the solutions that are required. So we were fortunate enough to be awarded an EPA grant for Sampson County air quality, and that is unique because, as we've heard, the 3 main issues that are impacting Sampson County are some of the most filthiest, worst conditions that you can experience. And every time I go on a toxic tour with Sherry, and we had a board meeting a couple months ago and Kemp was there and we went on the toxic tour, I always see something new that just repulses me. And so we will continue to fight and make sure that the methods that we're using in terms of the community engagement, which is bringing the community into the process through PM monitoring, and then as an organization growing by helping and creating more solutions through advanced air monitoring. We are acquiring new monitoring devices that are going to be deployed and tested there that will help us as an organization, help communities when we sit down with DHHS or have a conversation with DEQ we are not just talking about particulate matter, that we'll be able to talk about some of the things that rival what EPA is doing, along with the data acquisition in real time, or DARCAR. So we have the ability to take a wide swath of information from the community, learn from it, and then use that through our systems and mechanisms to continue to educate and push for advocacy as well as change. So that project is exciting to us. We have an opportunity to work with one of my favorite folks in this space, Sherry White Williamson, in that community. The second grant that I wanted to raise up and really talk about was the EPA Community Problem Solving Grant, which we, to your point, have not been awarded yet. It was supposed to come down April 1st, but our good friends at the EPA, I know they have our back. They will eventually get the money, or I will go to Washington and shake doors, which I like doing. So that EPA grant is again about measuring air pollution and health impact. And the difference is, and my team can keep me honest, the Sampson County is really a real research project, and we have an opportunity to dispel the complexities of that information and data and inform the community and work with Sherry and her organization to kind of help. The problem solving is more of an education endeavor for a community that has faced right now gentrification. They've got the transportation pollution. But I think the exciting thing is, as an organization, it gives us an opportunity to go through health impact assessment and partner with Atrium and DHHS on how do we promote having Mecklenburg County, which is one of the largest counties, again, add EJ into their health impact assessment and their chapters of their health studies. And so the community science part, again, brings back into community, which is always at the forefront, and then the education and health impacts. The goals of these are really understanding what are the health impacts on EJ communities, and then how do we then take that information to drive change through education and advocacy. So we're really excited about it. But I also wanted to kind of talk about some of the things that we've also done in our home market, where when you think about the work that you do in EJ communities, you always think about what is the impact that we can impart so that they can learn from what they have discovered in terms of their air quality and the issues related to EJ. But more importantly, how do they self-direct and really become a level of sufficiency from having access to reparation and revitalization of neighborhoods and efforts. So we started with the Historic West End in 2016 through community monitoring. That was our first inroads into particulate matter testing. It led to the creation of a report that then allowed us to advocate to the EPA to get an air monitoring that measured PM 2.5. So we like to say that the community drove that effort, and we helped facilitate that through our advocacy efforts. It also enabled us to create an airkeeper monitor network, and we're proud of that because, again, community members become airkeepers. We provide them with the information needed to understand what particulate matter is. We teach them how to use a sensor, how to hook it up, how to monitor and troubleshoot it, and then they become a part of that data science or the citizen science that we call community science. But as a whole, that whole effort really led to creation of a green district where there were over 15 projects that were identified. 8 of them have been completed, and they range from things like EV charging stations at businesses that the community that had started these businesses, Black entrepreneurs that said, we need a way to attract mainstream people into the historic West End because it is a red line community that's surrounded by I-77 and 85. People will pull off and charge and then leave dollars in that community. So we look at that as a benefit. We also continue to work with them because obviously we have the county as well as the city. The city has recently been a recipient of the Bloomberg dollars, and we've signed an MOU with the city of Charlotte to start to identify the corridors of opportunity that has been a project in Charlotte that did not take an EJ lens to the efforts of trying to improve these communities. So we've been tasked with going back and putting that EJ lens on those communities so that things like community development corporations can be formed, green job training and facilities can be created, and more entrepreneurial opportunities for generational wealth can be created by the efforts of addressing environmental needs. So we're proud of what we're doing in the historic West End. The work's not done, and we continue to do that. I will leave you with a couple of things in terms of what we focus on as an organization, and that's really continuing to develop that community engagement through our intake process. It's a process that Z has been working on, and I think in terms of understanding and going into a community and listening more than talking and getting what those issues and pain points are. It's the tenets of things that I learned in corporate marketing. When you sat down with the customer, you didn't talk, you listened to what the customer's issues and grievances were. We practice that now in here, which is kind of cool. Increasing transparency. One of the things that I heard when I first came in is tons of people come in and research all the time, but then they leave and never share the details and information. So we took that to heart, and when we received one of our grants through the Windward Foundation and Google to create an EJ data dashboard, that began a 2-year process to figure out how do we take data that we collect from PM monitoring, marry that up with other data sources to render out a complete picture with explanation of what they're looking at, where they're looking at it, and how it may impact them. And there's always things that come out of that. And when we did our first review, I remember Omega Wilson said, hey, we want to be able to look at where we not only need to be advocates, but where do we need to be activists, right? So can you tell me where the issues are when I look at the map so that I know where I need to go with my organization? So that's keen input from the community that we're working to try to incorporate that I think means a lot in terms of putting on a tool that's value add, as well as keeping the community in mind. I think the other thing that we talk about is improving our monitoring. The bottom right picture is the Moderator, which is a pretty expensive piece of equipment, but gives us a level of being able to detect and monitor for more robust chemicals, VOCs, and those types of things. And it moves our organization into more of an enabler to communities of understanding how do you take a prescriptive approach when you get a call from a community member who says, I smell something funny in my neighborhood, can you help me? We want to be able to do that. We want to continue to advocate through EJ community inclusion in county health programs. We'll be doing that when we do our Pottstown and Huntersville, Western Davidson, and I know I'm leaving out one of them, but it's all of the area of North Mecklenburg that then gives us a complete level of coverage of doing something in most of the EJ communities that make up the greater Charlotte area. Education is another key area in terms of what climate change is. I've heard more new information just in the last 3 hours that I've been here that will help us create additional curriculum, and we hope to do that through a learning management system so that community members can come in at their convenience and learn about things that are impacting them as one of our key visions. And then finally, advocating, right? The Duke Carbon Plan is what resonates most with me, where we had over 300 people register for our webinar. We're hoping to get at least 100 comments into the NCUC docket, but it's really about measuring how we can make an impact and how do we then do things through advocating for communities that really move the needle. So that's what clean air is, and I'm happy to be here. And I hope I did myself okay with the geniuses up here.
Thank you so much. So we'll go ahead and open up for questions from the audience. Are there any questions off the bat? I'll start. I have a question for both of you. What do you see as the biggest opportunity in North Carolina today to address environmental injustice and move the needle in health? What's the lowest hanging fruit that we can be thinking about to move the health needle?
You just ate lunch.
Well, I think in some ways the biggest opportunity is the momentum for environmental justice at the state level right now, and the executive order and all the things that I talked about that are happening right now to try to address that. I think we're required to have a report to the governor in October, so we have a deadline at least to get these things going and move the next stage. So I think that's a pretty big opportunity. I think the piece about cumulative impacts is a really important one, and figuring out how to operationalize the measurement of cumulative impacts. And the longer version of my presentation, I actually touch briefly on the environmental justice law that was passed in New Jersey, which talks about cumulative impacts. And until I read about that in the Environmental Justice Advisory Board's report on cumulative impacts, I didn't know that there was an environmental justice law in New Jersey, and that potentially someday maybe there will be one in North Carolina. Now, I would not call that low-hanging fruit, let me be clear, but I still think it is always valuable to have those models out there and, you know, to help kind of frame the direction that we're moving in. So I guess that's what I would say is some of our opportunities.
I always think about low-hanging fruit and have these crazy images. If watermelons grew on trees, you know, everything would be easy. I always think about social determinants of health and how we can take the things that hinder, hamper, or impede those, the ability of, whether it's North Carolinians or U.S. citizens, the ability to enjoy their lives without being impacted by concentrated animal feed operations or the amount of transportation traffic that rural communities see when they put up miles upon miles of big box warehouse stores, or the landfills that get filled up, where Sherry just told us today at lunch, 73 counties in North Carolina feed all their junk and crap to Sampson County landfill. So, you know, I think the other side of it, and then, you know, I read an article last week about being more positive, that there are more good things happening in the environment. And I like to believe that, although there's some days where I question it. But we're at a really unique time frame in terms of we have an administration that's on the precept of being able to really do some things in the second term based on the benefits that they've done in the first term in terms of bringing monumental amounts of money to environmental justice communities. And I equate it to when you get a call from your boss and, you know, they found funding for you to do a project that you need to do on the corporate side that's going to generate billions of dollars. We can change millions of lives with the amount of money that is available. And I think about the last thing is, how do we gain synergy? And I know it's more of a term that's used and overused, and is one of those conference room buzzword bingo things when whoever says synergy first, you drink your coffee. But there, you know, you can listen to the comments and the conversations that we have, and we're starting to piece together where you've talked to one person, I've also had that conversation, and this is what we're doing, and then we decide that we need to meet in the middle to be able to really get some traction on the issue. We just need to do more of that. And so that's the thing that keeps me coming back, is finding those communities where I have a partner, where I have a role to play, where we have the municipality on board and the state government agency is there to help and be a partner with us. And so I think that's where I look at where we have any low-hanging fruit.
Yeah, that's great. When I think about cumulative impact, so I'm a general pediatrician, so I have a biased perspective. But kids are the most important, right? You're thinking about cumulative impact, and so much of the work that I feel like that's happening tends to focus on adults. And I think kids, you have to really remember to keep kids at the forefront of our minds in this work, because they are the most vulnerable and the most susceptible to this cumulative impact that they are accumulating over their lifetime. And I see that as a really great opportunity for intervention. If we can intervene for our kids, this next generation of kids growing up can have very different health outcomes than their parents and grandparents growing up in the same communities.
I would agree. I think, you know, the thing I noticed at Earth Day, the amount of kids that were there, and their ability to comprehend and become interested in complex things about the environment. And they're like sponges, so I think that's where we focus so much on how do we get into the K through 12 space more. how do we get more soldiers that are in the fight so that some of the things that are happening won't be allowed, right?
That's right.
So,
Yeah. Ms. Bidding, I think you had a question?
Oh, no, I can't resist temptation on this one. But I heard, Callie, I heard you, and you all, you know, and Rachel Zimmer actually know that on January 31st, 2022, when the Weaver fertilizer plant explosion happened, I was the first person to place a call and get over 300 people on a Zoom meeting to talk about what had happened. I must admit, though, that I'm sitting here a little uncomfortable because I know historically what typically happens when Black and brown communities are faced with those type of things. I'm really disappointed in the results because I just cannot sit here and believe that the results are what was just presented to us. And it takes me back to growing up in Happy Hill when North Carolina Highway 52 was constructed that divided our community and all of the traffic and then we started hearing about all the asthma and all the allergies and all the other things. But I'm really kind of concerned that the results that were presented and that there was I'm no scientist, but I'm really struggling with the fact that after that, the Weaver family walked away scot-free. The Weaver family did not have to invest $1 in cleaning up the homes of these people of very low means. And elderly people who were widowed that I personally know, who never fully recovered, who just incurred so much damage. Their water doesn't taste the same, their air doesn't work the same, the particulate matters that they're seeing, they live there every day. That we're being told that there was no, I don't know if it's the EPA's determinants based on what was found. I don't know, but I'm really struggling with the results that I just heard. Now, I must tell you that.
No, I really appreciate your perspective. So just to clarify, the results that you're referring to, I think, are the environmental assessment, which didn't find any abnormal results from our testing, which didn't happen in the immediate aftermath of the fire, right? We didn't start our testing until the fall of 2022. We haven't analyzed the data yet on those acute and chronic conditions, so that still has to come, and the data on hospitalizations and ED visits and clinic visits. So we're still in the process of analyzing that and hope to have that out shortly. Yeah, I mean, that's part of the tricky thing about research, right? Is you go into it with these questions and then you don't know what the answers are going to be. So I think the best thing that we can do is prioritize getting this data back to the community. We don't want these results to stay in academia and in published manuscripts. We want that to happen too, but we really want to make sure that we're prioritizing getting the data back to the community. I know Dr. Young is continuing to work with the Piney Grove community and other neighborhoods in that area to do additional samples from people's water who have concerns. So that testing remains ongoing, and if there's additional funding opportunities, we'll be able to expand that even further. But we definitely we hear those concerns. We heard them in interviews, and we continue to hear them from residents in that neighborhood. So we absolutely agree.
Or I can use my future voice.
So Jeff, my comment's more for you if you're looking for a project. I'm sure Winston-Salem is the only town in North Carolina with this issue, but if you drive in the afternoon in Winston-Salem, you need to have every school mapped out and when their dismissal time is, because the parent pickup line, or kid pickup line I should say, is a mile long, starts an hour before dismissal, and I'm kid-free, but I've gotten caught in some of these lines before. What's happening though is you've got our kids and teachers who are out standing in line being exposed to that car exhaust morning and afternoon, and I think that would be a fascinating study to put air quality monitors in those astronomical lines and see exactly what is going on over time.
Yeah, that's a great idea. We did some work years ago on school bus emissions, and I think we've been trying to figure out where we might fit in with that. We're also working with CMS schools and have had discussions about, and we've actually placed monitors at some schools. And I think that is something that we need to definitely look at, because we see it in Charlotte as well. So that's a good call out. Thank you.
I'd like to ask about how the pandemic changed, or maybe the trajectory of environmental justice, especially in terms of health, because I did a lot of reporting on the impact of the pandemic on Charlotte's Black community. That started it out, but the more reporting I did, it was so clear the link between the people who were suffering the worst were the people who lived in the worst environments. You know, there were all of these factors that tied in and linked things together. So I'm just asking you guys, did you make that connection, and how did you handle that in the work that you do?
I'll start. I mean, I think that the COVID-19 pandemic really highlighted health disparities front and center. And I think that, at the Department of Health and Human Services, that became very clear. It really, no matter where you looked, whether you were looking in occupational settings, whether you were looking in who was getting vaccinated, whether you were looking at who was getting hospitalized, early in the pandemic, there were huge disparities. And, luckily we had the data to see that and be aware of it. And there was a lot of effort, again, speaking for DHHS, there was a lot of effort put towards trying to narrow those gaps that were so glaring at the beginning. I think for environmental justice, that focus on health equity kind of helped boost environmental justice forward a bit, within our agency. I'll, again, speak for that. So, because, in public health, health disparities, health equity, you can't work in public health without having some awareness of that, because you see it every day. But the spotlight that was put on that, and the investment that was put towards reducing those disparities, then, when I start talking about environmental justice, people are like, oh, right, here's another example, here's another setting where this is occurring, and, with different exposures. And so, I actually think it helped to propel things for environmental justice, at least within our agency, and maybe out in the public. I would be curious whether others feel that, because I know the disparities were reported on quite a bit, and so maybe that also helped others just kind of see those differences that, those who work in those areas might be aware of, but the general public may not be. So.
Yeah, I know for me, I think back to where I was finishing up my sustainability program certification, and I was doing some consulting with a couple of organizations that were working on DEI initiatives, because during the pandemic, EJ communities and issues, whether it was policing or protesting, had been heightened. And so I kind of have to agree with Virginia, is that when I came into the organization and was looking at programmatic work, the amount of action alerts and issues in EJ communities around air permits and some of the issues around health, and we created a program, or there was a program that was already in existence called MAHA. There was a higher level of interest at the health side of things to understand cumulative impacts and implications of climate. So just looking at that, not really fully immersed into the organization, those are the trends that I was looking at when I was considering taking the job. So I definitely think EJ communities at the time received a heightened level of awareness just because of what was happening socially.
One more question. You want to bring the box? Or? Oh.
Toss the box.
Hey y'all, you talk into this. Edgar Miller, the Yakima River Keeper, and I approve of the Cape Fear River Keeper being here today. But yeah, you mentioned DEI, and I just noticed some of your collaborators were UNC and other public universities. Are you concerned about this pushback we're seeing from the Board of Governors and the trustees on DEI-related programming in our public universities having a negative impact on efforts to collaborate with the universities on environmental justice?
Personally, I'm not. I think what I heard this morning on the panel is if you talk about the facts and you lead with information, you form something that's a little bit hard to dispute in terms of the validity as it relates to what's happening. And so, I think in this room where I believe we're all allies and we have a proclivity that leans towards fixing what's wrong with the environment and we believe in science. I think if we change our terminology and we still mean the same thing, it's kind of a Trojan horse move, right? In terms of instead of talking about we need to, help a specific group that may raise a level of awareness. It's a development project that helps reduce burden, right, or cost to the system. So I think we have to do two things in terms of creating the environment where we are leading with science and a fact base that's undisputable, and then manage how we describe these projects and the things that we're working on. But I haven't noticed any change. Got a call from NC State to work on projects. I think people realize that if we solve the issues that EJ communities experience, everything improves for people. So we have to remember that, right? It's not just helping the people that have been overburdened, impacted, underserved for years. In fixing those problems, we fix a number of problems for everybody. And that's where, stop talking about a pie. It's not a pie. It's enough resources for everybody. So I'm not personally worried about it.
I think that sounds like an optimistic way to end the session. So thank y'all so much. We really appreciate your attention. Thank you.